experience in Las Vegas. PHLV Radio. The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha! Good evening. Magandang gabi po sa inyong lahat. Maraming salamat po sa patuloy niyong pagtangkilik sa aming programa, Healthy Monday with the Apina of Nevada. I'm yours truly, Dr. Mary Faye Axon Armstrong, founding president of the Asian American Pacific Islander Nurses Association of Nevada and professor at Roseman University of Health Sciences College of Nursing. COVID-19 vaccines are out. So let's continue to know and understand about COVID-19 vaccines. Last week, we invited a guest host, Professor Randall Sasa from New York, to share what's going on in the minds of some of our healthcare professionals in the East Coast. I hope we were successful in bringing awareness and better understanding about COVID-19 vaccines to all our listeners in the Valley and beyond. The numbers of mortality and infected individuals globally are continuously increasing. But we are gradually receiving some positive results for those who have been vaccinated with COVID-19 vaccines. Well, one of our guests tonight volunteered to be a vaccinator from our recent community outreach in Summerlin, Nevada, or from Roseman University College of Nursing. And tonight, we will also hear from our Apina Roseman University Student Nurse Association's outgoing and incoming president. So I'm excited to hear from them. But before we begin our discussion, I encourage all of you out there, everyone, to go to immunizenevada.org/COVID-19-vaccine-planning website to continue to educate yourselves and keep updated on what's happening in the Valley. There are important information about the Pfizer, BioNTech, and Moderna resources. One note I wanted to share is just because you are willing and wanting to get the COVID-19 vaccine doesn't mean you will get vaccinated. So on the immunizenevada.org website is a pre-vaccination checklist for COVID-19 vaccines. So we will project it on during this broadcast. So there are questions to help healthcare providers and the public to determine if there is any reason you should not get the COVID-19 vaccine. And here are some of the questions. Are you feeling sick today? Just like the flu shot, you don't want to get it while you are sick or immunocompromised. Have you ever had an allergic reaction, anything that will require treatment with epinephrine? And those are people who have severe allergic reaction from polyethylene glycol or PEG, polysorbate, and if you had a previous dose of COVID-19 vaccine. Have you ever had a severe allergic reaction to something other than that and all was previously mentioned? Have you received any vaccine in the last 14 days? Have you ever had a positive test for COVID-19 or has a doctor ever told you that you have COVID-19? So now we're getting to know and understand this virus. That doesn't mean you're not feeling sick, doesn't mean you don't have it. Have you received passive antibody therapy like monoclonal antibodies or convalescent serum as treatment for COVID-19? And do you have a weakened immune system caused by something such as HIV infection or cancer? You're getting chemotherapy, or do you take any immunosuppressive drugs or therapies? Two more questions. Do you have a bleeding disorder? And then, are you pregnant or breastfeeding? So please visit the website. We're projecting the questions here as a pre-COVID questions immunization before you get it. So at this time, I would like to welcome our special guest tonight from Roseman University College of Nursing, specifically our Apina Rosna students. So we have Case Quito, we have Megan Siriaco, and we have Alice Marcelo with us. Welcome to Healthy Monday. So let's start with Case. State your full name and your role with the opinion of Rosna.
Hi guys, it's me again, Case. Actually the current president of APNA, Rosna, but I'm about to step down this incoming February. So our next president is going to be Megan.
Hi, Megan.
Hello. As Kay said, I am the incoming president for AAPNA. I'm very excited to be a part of it and willing to take on the challenge. I'm excited.
Great. Alice.
Hi, I'm Elise, and I'm just a member of APNA. Yeah, I don't know.
Yeah, Elise is actually the nursing student who volunteered and became a vaccinator last weekend, I believe. So we prepared some questions to ensure our listeners will get the most of our discussion tonight. And I would like to congratulate all of our Apina Rosna students for a job well done. Amidst the COVID-19 global pandemic, everyone showed their truest capacity, resilience, and caring and loving others. And we really all have learned valuable lessons during this COVID-19 pandemic. And I'm so proud of all of our nursing students, not only Rosna, but everybody in the Valley, students who persevered with their academic endeavors, studying, preparing, and eventually to become professional nursing force out in the community. So the first question I will direct to Case. So what are your thoughts about the significant and drastic changes that is happening in the nursing profession?
So I feel that the benefit of COVID is that the healthcare profession as it is advancing with technology. But at the same time, we can observe nurses getting over fatigue and healthcare workers being exposed to hazardous work environment and all that. If we look at the negative portion, it's very discouraging as a nursing student, but also earlier on, I feel like this is what we signed up for. We didn't know that pandemics are gonna happen within our time frame, but I feel like with the technology and researchers, our knowledge is actually getting better on how to handle things. I mean, if anything, if this is gonna happen in the future, we're gonna be better equipped and we won't have shock as we did with COVID-19.
Great, thank you, well said. How about you, Megan? So what are your thoughts about the significant and drastic changes that is happening in the nursing profession?
I mean, I think ultimately the nursing role is changing actively. Can you guys hear me?
Yes.
Okay, yeah, I think the nursing role is changing in a way that we've never seen before. I mean, I think nurses are being asked to do a lot that we originally didn't realize we were signing up for, but as Kay said, this is what we have signed up for. And I think that all nurses are willing to take on, or a lot of nurses have been willing to take on these challenges. And I mean, it's heroic. I think what we're doing and what students are doing is heroic. To continue to be in nursing school right now, you got to really want it, and just know what you're signing up for.
Yeah, thank you, Megan. A lot of challenges, and as Case is mentioning, thank goodness for the advanced technology. Otherwise, there's a halt on your progress in the program, and you would have to wait until it comes about. So I think that a lot of the institutions who are financially stable are able to have their nursing students continue the program. I don't know if you heard that in other states, some of the programs were on hold, and they couldn't start until they're able to connect everybody through virtual learning, right? Elise, how about your thoughts about the significant drastic changes?
So I don't know if I look at it so positively. My mom is a registered nurse on the East Coast, and I've heard stories here and there. But from what I've heard, it seems like in a lot of places there's just not enough nurses. And yes, what can you do about that? But sometimes nurses with COVID and they don't have symptoms, they still have to come in to kind of, do what they can. And eventually they get burned out, and even mentally they take a hit. And that's definitely an issue that needs to be looked at. And even afterwards, there have been studies that show they have a sort of PTSD from this. And it's terrible in a way that we do have to do what we can to get through this. But there's going to be repercussions after this. And unfortunately, I don't think COVID is going to go away for a while. So, I mean, just nursing aside, we're taking a hit.
Yes, and thank you for mentioning about mental health. That is so true. The post-traumatic stress syndrome disease and the depression is very real. I would have another segment. I interviewed Dr. Tanya Sorrell, who is my colleague from the Substance Abuse and Mental Health Service Administration's Minority Fellowship Program, and she spoke about the challenges that they're having in Colorado. So I know that I wanted them to jump in here. I know it's not one of the questions that I gave you, but I wanted Elise to share with us her experience this past weekend as a vaccinator for the COVID-19. Can you share with us first how you came to be one of the vaccinators?
Before we had Christmas break, there was an email sent out that the Health District of Nevada was interested in looking for volunteers. So I signed up for that list, and I believe Dr. Jones he probably did it with a team, but he created a COVID course. So we would have to kind of do some training on your own and take a quiz so that when the time comes, you can go out and help vaccinate. So they were planning their first, we call it was a POD. I think it means point of distribution, which is where the CDC allows you to vaccinate. You have to follow guidelines. So last Saturday was the first time that Roseman ever decided to try it. And I was only there for 3 hours in the morning. And I'd have to say it went really smoothly. We had the commander who was kind of in charge of everything. Her name was Dr. Christina Madison. And she kind of talked about setting it up. She wanted to make everything organized. So there are labels for everything. And you had to go through a flow process because, you have to social distance. And I personally was a vaccine prepper. So I shared my responsibility with someone else. Basically, what I had to do was every hour you have to just log the temperature because vaccines have to be at a certain temperature. Things like when you take the vaccine out, you can't just use it right away. You have to let it thaw for 15 minutes. So I had to set so many timers on my phone. And then my colleague, she was drawing up the vaccines once it was ready. So every time she punctured the hole, I would have to tally okay, that was 1, 2, 3. So they had to log every single detail too. And, even though it was very, there's just a lot of details to look out for, but it was a very nice experience.
Great. What was going in your mind while you were doing this task?
Initially, I was very nervous because even though the district commander said you have a very important job, make sure you do everything because it's true. We were drawing up the vaccines as people are coming along because you don't want to drop too many and let it go to waste. So we had labels to put, one on the vaccine and one on the tray. So we would kind of stack them. And then, because there were a lot of people in the beginning, I think there was like 6 people to like an appointment slot. And then there were other people a part of the process. Like you had to check in people, they would check in with their documents. And then behind me were the actual vaccinators. So, we had to work as a team, and even having like some of the faculty, I could ask them for help. So it was really nice knowing that you were never really alone.
Great. Yes, that is true. In nursing, you don't. There's no such thing as there's no man in an island. There's always a team effort. There's always someone who is double checking. And I know Dr. Christina Madison. We were both interviewed in one of the radio show for PHLV, and she's very knowledgeable about what's going on and what tier are we. Nevada, state by state, we have different tier. I know that I saw on one of the social media and also on the website where Kaiser Permanente is actually offering it to their members, their plan members who are 65 years and older. So, so what the tier that you did last weekend is for healthcare frontliners, right? We are not in tier 2 yet for the other people. So. Let's go into thank you for sharing your experience. I'm sure that is something that you will never ever forget in your lifetime. And as you embark the career of a professional nurse. So the next question we have is, how are you preparing for the modification in healthcare as we are facing this global pandemic? So let's start with Megan. So how are you preparing for this modification in the healthcare?
Honestly, when I first applied to nursing school, I didn't know that we were going to be in a pandemic. So I'm still trying to figure it out. But I think just making sure that my mental health is in check is a big thing for me, not just in nursing school, but in preparation to go into actual bedside nursing, just making sure that my mental health is good so that I can, take care of patients well enough. Like there's just, I don't know. I'm still trying to figure it out at this point. I'm sorry.
I think you nailed it, where self-care is very important. You can't take care of others if you are not well yourself. And not only really mentally, how I emphasize to my students the holistic view of patient care, mind, body, and spirit. You have to make sure you eat well, nutritious food, you make sure you sleep, have enough sleep, right? And also be able to, socialize in a way that we're still following the physical distancing. And a certain culture, as we are Asian American Pacific Islander focus program, I think the Asians, mostly I can only speak of my ethnicity, that we just like to party. We should like socialize and be with family, as having big family. Okay, Case, what about you? How are you preparing for the modification in healthcare?
So next week, our cohort is lucky enough to start our senior practicum actually in the clinical setting. So I feel that for this whole straight month, we have to sacrifice not meeting up with family, our friends, just to make sure that everyone around us is safe. And then, the basic precautions, hand washing, wearing of mask, and like they now have these stuff like, when the COVID started, they would give us those thin films acrylic mask. But no, they're just like this thin film that break easily. But now you can buy like extra protective ones. It's like acrylic polycarbonate, and it actually is better because it's not that heavy and it doesn't hurt your forehead at all. I feel like I will be wearing a lot of those. And then, yeah, just as I've said in the previous episode of PHLB Radio, it's important that we alter our routines, only go out when we really need to, like grocery shopping. And then if you want to exercise, just do it at home if you can. Just protect everyone around you and, of course, yourself as well.
Yeah, good point about the mask. I know that my last rotation at Desert Springs, we were required to wear a face mask. In addition to the face mask, we're required to wear a face shield. So I know it's like we're all covered. It's hard to breathe. It's hard to, and then you can't even show your lipstick, right? I have to put some sense of humor in it. Like sometimes I would prepare, put my makeup on tomorrow. Oh, I don't need to put lipstick now because it's going to be covered anyway, So what about you, Elise? How are you preparing for the modification in healthcare and as we are facing this global pandemic?
I mean, part of it, the social distancing and wearing the mask, hopefully I've got down pat. But as Kay said, we're going to clinicals next week, and I'm starting on Monday. And I'm a little nervous just wearing the extra stuff because I'm not used to it. It's just a different experience I have to get used to. But I think as long as I wear all the required PPE properly, I'll be okay in that sense. But as Megan also mentioned, I definitely need to work on self-care, maybe even set boundaries where I need to, but also reach out to friends, even maybe preemptively. Like you never know if you're going to have a bad day, and you do need your friends and family to rely on, even if it's, virtual or even texting or calling.
Yes, very important self-care, protecting yourselves and your family. When I got interviewed in one of the TV show, I didn't emphasize more on, the vaccine or more technical information, but right down to if you're going to educate and increase awareness with the Asian population, I can only speak with the Asian population, is our family are important. If anything, most of us will do all of our academic endeavor, our professional endeavor, but when it comes to it, we're doing this for our family. So I think, how we target the Asian population is target how for the safety of their family. A lot of the elderly that I took care of and educated when I was a diabetes nurse educator, they would say, oh, I just want to eat everything that I want. I'm old already. I've lived a full life. And it's true, our elder population lived a full life, but then equating it with what's happening, we want to protect ourselves because we wanted to protect our loved ones. And I think that's a very strong message that we can send to our community out there. I know there's a question about innovative interventions. I mean, anyone wanted to answer this. What's happening? Does any one of you work in any facility besides being a nursing student? Okay, so yeah.
I worked in a respiratory and allergy clinic before.
Okay, share with us your experience in that and what kind of innovative interventions are happening in your facility.
Well, I was a scribe, so I was fortunate enough, I didn't touch patients beforehand. But as far as like the providers and the nurses, we went completely online when COVID first hit. And that was an adjustment for sure. Just the learning curve and trying to figure out how to treat allergy and respiratory patients in particular over the internet was hard, especially with it being COVID and there being a lot of fear from these respiratory patients. So just learning how to ease their anxieties as well as our anxieties was hard because there was just so much uncertainty early on. I left several months ago, so I don't know what they're doing now, but I know when early on during COVID, it was a lot of just learning how to ease anxieties, for sure. A lot of just talking through the stresses of being a respiratory patient and being high risk. So.
Yeah, and anxiety itself can exacerbate, respiratory conditions, right? As you would know. And I'm glad that you mentioned what you're talking about is telehealth. Telehealth has been, I think, when I was still not even thinking about being a nurse, it has been already in its development. But now here we are, and it's telehealth that's that took care of our patients who were not able to see face to face. So there's so many things that we can talk about with this COVID-19 preparation. And I know time flies when we're having fun. I mean, we're almost complete with our program. And I think what I wanted to hear from Megan and Case, I know Case is doing an excellent job as the current president for the Apina Rasna. And then you are now turning over the baton to Megan, right? So do you have any words of wisdom for Megan?
I would say academics comes first. You always have to prioritize ACADS first over org responsibilities. But you also have to incorporate the organization in your daily life. Like you have to make sure that all members' concerns are addressed. And I would say take it one day at a time. We're always here to support and guide you. Even after nursing school, you can contact us. And if anything, Dr. A is always there. She usually responds. But I think you will do great. And we're not going to leave you guys hanging. We are creating a document that will actually help you guys in organizing events or coming up with events, because we didn't have that from the previous officers, and it was a very hard transition. So we're trying our best to make it a smooth transition for you guys. And I hope that you can continue on with nursing student food pantry, because it really helps out a lot of nursing students.
Thank you, Case. I know you have the words of wisdom is so true. You're not alone. There's always the group of people who will help you. Just like she said, I always respond, sometimes just bounce back some information to me. And it's really good to hear for our listeners out there in our community of what are the activities our nursing students are going through in the midst of this COVID-19. Life goes on, right? So the benefit of being in an organization that's actually part of what you're going to be doing when you become a professional nurse, and having an experience while you're in nursing school is nothing compared. It's like priceless, and I would say. So I think what I'm going to ask you guys is to say any words of advice to our listeners out there from a nursing student perspective and future professional nurse perspective. Let's start with Elise.
I feel like, at least in Nevada, it's been drilled into our heads because of commercials and ads, but wear a mask. It's like you wear shoes, you can wear a mask.
Yes, I still see some people, as soon as they come out of the grocery stores, they take off their mask. And I just like I said in the previous episode, I give them, evil eyes. That's all that I can do. Okay, so Megan, what words of advice do you have for our listeners?
From a student perspective, I'd say just take it one day at a time. We're living in like unprecedented times. So, and things are changing so fast every day. So just take it one day at a time. Really take care of yourself. As Elise said, PPE. And just, if you're not doing it for yourself, do it for other people, your family, your friends. Do it for others. Care about others. And if we work together, this will all be over.
Yes, nursing is about caring for others and helping them get well, right? Case, any words of advice to our listeners?
I would say the most important precaution is hand washing. So always make sure that you carry hand sanitizers, alcohol in your cars, in your purse. In addition to the mask, always have an extra one in your bag, because I see a lot of people, they always forget. So it's always best to keep an extra mask. And also check on your friends, check on your family members, because staying at home can take a toll on the mental health. A lot of people actually are getting depressed just by staying at home because they can't socialize. So it's very important that we check on them. And of course, social distancing. Don't go out if you don't have to.
Great. I wanted to thank all three of you for your willingness to be our guest tonight. Maybe one of these days in the near future, one of you will be our guest host. Nothing is impossible, right? So it would be a great experience for all three of you. But I wanted to just say to our listeners out there, just because you get the COVID-19 vaccine doesn't mean that you're fully protected. Look at the efficacy. I know that there are different manufacturers who are now sending it out, but the top two that we have, look at the efficacy. I think one is 95% and one is 92%. That would be the next episode. I'll bring in someone who is specializing immunologist and someone who is very well knowledgeable about that. But I wanted to thank all three of you for spending tonight with us. So as a Monday night, it's always, I hope that our listeners out there are looking forward to our show. So thank you again. Thank you to PHLV Radio as our community partners in bringing this information to our community. And remember, always remember, every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with Apina of Nevada.
This is your Filipino radio experience in Las Vegas. PHLV Radio.